we now move to our panel discussion. And we all want the audience to know that throughout the day, that there will be opportunities for you to ask questions, and we'll encourage you to do so through the Q&A box located below the live stream. While the workshop speakers will be answering some questions live, we've asked that they respond to those not addressed on the Slido platform immediately following the workshop. So we kindly ask you to, put your questions in and to keep those questions concise. And I'm sure that Dr. Williams was very powerful and a good beginning for this foundation on which we'll now build with the panel discussion on neighborhood and built environment, where we'll examine the available evidence and mechanisms and impact of structural environmental risk on and outcomes of CNS disorders and biological aging, and explore evidence-based resources, opportunities, interventions to reduce health and safety risks associated with the natural and built environment. We're really happy that Dr. Jennifer Mandley, Professor of Neuropsychology in the Department of Neurology at Columbia University, whose research focuses on aging and Alzheimer's disease, will be the moderator for this session. Dr. Mandley, please.
Thanks very much. So as Professor Williams just told us, inequalities in health have existed for a long time. The medical and scientific fields have known that inequalities exist for a very long time. And health equity researchers have demonstrated the causal link between the racial hierarchy that maintains multiple structural and social mechanisms of health inequalities for many years now. But researchers and medical providers that focus on CNS disorders and whose goal is to improve, often to improve brain health, have been relatively late to the table compared to other areas of health, such as cardiovascular diseases, infectious diseases, and maternal mortality. So we need to better develop the science of central nervous system health equity, because although it may have some overlap with other health equity research, we need to understand what are the optimal windows of opportunity to intervene and the disease-specific processes that drive inequalities. So the first expert panel of our webinar series was chosen very intentionally to address these issues and to introduce us to some of the existing research on these links across the life course. I'm going to introduce our first speaker, who is Dr. Daniel Hackman, who is an assistant professor at the University of Southern California in the Suzanne Dworak Peck School of Social Work. Dr. Hackman?
Thank you very much. It's an honor to be here today with you all. Can you go to the next slide, please? In our research on neighborhoods and child development, we take a life course approach and are really interested in investigating potential developmental origins of disparities in health outcomes broadly and CNS disorders. Or in other words, investigating the proposition that disparities across the lifespan may, at least in part, have their roots earlier in development. And this can be due to disparities that emerge in childhood and adolescence and persist, or in early differences in psychosocial and biological development that may be part of the risk pathway to later emerging disparities in which the timing and accumulation of experiences and exposures may matter. In most developmental theories, children are thought to develop within a broader, dynamic, multi-level context in which individuals grow up nested in micro-level environments, such as families and peer relationships, that are themselves nested in higher level or meso-level contexts, such as physical environments, including pollution and toxin exposure, social environments, service environments, including for children's schools, and that many of these factors, or all these factors as well, are nested in higher macro level structures that we've already been discussing in terms of economic forces, policies, structural racism, and more. And neighborhoods are important not only as one such higher level developmental context, but as was highlighted earlier, given historical practices, structural racism, and so forth, it's a predictor of a cluster of such factors and developmental contexts. Although there is some mixed literature, neighborhood disadvantage has been associated with worse mental health in adolescence, as well as biological indicators of stress or weathering, similar to those mentioned earlier, that may raise the risk for worse health outcomes. However, when it comes to differences or neighborhood-related differences in brain development that may be relevant specifically for CNS disorders, there's been much less research. In the past few years, this has been an emerging research field with a number of teams showing that during adolescence, neighborhood disadvantage is associated, for example, with aspects of brain function, such as the connectivity between regions at rest, or brain activity during tasks of executive function or emotional processing. And similar questions have been asked with respect to brain structure. If you could go to the next slide, please. And in this way, I just wanted to highlight one of our own studies from our team as an example that also, I think, raises some important issues for consideration. We used the Adolescent Brain Cognitive Development Study, which is a landmark study of nearly 12,000 youth and their families, beginning at age 9 to 11, that are being followed longitudinally. And in baseline data, we examined if neighborhood disadvantage was related to neurocognition and brain structure independent of, for example, family socioeconomic status. And as you can see in the top panel, we found that higher disadvantage was associated with worse performance, in this case for working memory. But this was actually a pervasive pattern across tasks and different neurocognitive domains. And when we examined brain structure, what we found, as you see in the bottom right panel, that higher neighborhood disadvantage was associated with lower total cortical surface area, as well as other measures such as total subcortical volume. And thus, although there were some regional variations, differences in both brain and behavior tended to be kind of global and pervasive in nature. It was also specific to neighborhoods, as this was independent of multiple indices of family socioeconomic status. The ABCD study is also a multi-site study, and we found that despite differences in neighborhoods characteristics across areas, these associations were largely similar across 21 different metropolitan areas in the US and driven by local variation within each area. But you can also see evidence of high variability. These are small to moderate sized effects of population rather than individual level relevance. And many youth from disadvantaged neighborhoods are outperforming their peers from affluent neighborhoods, which at least potentially suggests resilience. And so consequently, across all of this early research in the area, there's evidence of some systematic associations, and thus neighborhoods appear to matter in a certain respect for brain development, with the caveat that causal evidence is lacking thus far. And this is a newly developing area of research, and thus there is much to learn, not only longitudinally, but also particularly in terms of the role or relevance, if any, for CNS disparities in childhood and beyond, but it's a promising area for research. In addition, kind of putting it all together, this suggests that additional research with a focus on prevention and intervention would be valuable, particularly thinking about those modifiable protective factors that were mentioned earlier that can promote health and well-being and promote resilience, as well as kind of structural change, investing in communities, improving neighborhood conditions, and empowering communities to further equity and health.
Thanks very much, Dr. Hackman.